covering more of Arizona's kids in the upcoming budget.
30 to 40,000 kids will get covered who didn't have coverage before, and that will affect exponentially the whole population because it will help their families, it will help these kids succeed in life.
From healthcare to classrooms.
As far as the slice of the pie that education gets, it's half of the budget, so we do take it very seriously.
State lawmakers working overnight to agree on a budget. This is Arizona Week. The clock is ticking for state lawmakers to reach a deal on Arizona's budget. On Thursday, I traveled to the state capitol for a look at some of the biggest talking points. Healthcare for some of Arizona's poorest families is among the subjects. Here's Dr. Elizabeth McKenna.
Arizona has 160,000 children who are uninsured. We have the second highest rate of uninsured in the nation, and we're the largest proportion of those kids are in the range of 138 to 200% of the poverty level. So the need is very, very great in Arizona.
What happens if these kids don't have access to health care?
When a child doesn't have access to health care, when they're sick, they can't go in to be seen by a physician or a healthcare provider. So a minor illness like a cold or bronchitis can turn into a major illness like pneumonia, oftentimes needing emergency room care as well as many times hospital admission. And this oftentimes uncompensated care is extremely costly to both the state as well as the hospitals themselves.
Have you seen this firsthand in your practice?
Oh yeah. I had a mom just last week. When kids don't have health insurance, they can't go into the doctor, so they have persistent and prolonged illness, and they miss a lot of school, and their parents miss work. I had one patient last week that the mom called me up and asked me to write a letter because her two of her kids had been really, really sick, and they hadn't been able to attend school. So the school was going to send her to court because they'd missed so much school. But the reason why they'd missed so much school is because she lost her health insurance and were unable to bring her into the doctor because she didn't have any insurance and couldn't afford it. So we've seen it firsthand. When temporary Kids Care 2 ended in 2014, many children of Arizona's working poor lost their health insurance. And these are hardworking families who pay taxes. They make too much for access, but too little for private health insurance premiums. And we thought initially that many of those kids would be covered by the ACA marketplace plans, but it rapidly became clear that the copays and the premiums and deductibles were prohibitively expensive. I have a family in my practice, and there's 5 kids. The father is a grocer, and he made $20 too much for access, so they couldn't get access. One of their kids had a serious neurologic disease called neurofibromatosis, and when their 5th child was born, it rapidly became clear that he most likely had it as well. However, the parents couldn't afford to bring him in to the specialists and to get the full evaluation and workup, and so the kid wasn't diagnosed for a long time, and he missed really necessary services, provision of services, evaluations, medicines that were important to him. They had another child that was a child with speech delay, and this wasn't diagnosed until really late because they were unable to bring their child in for their routine health care visits because they couldn't afford it. So the child went really late without being given like appropriate speech therapy and everything. So yeah, I see a lot of it in our practices.
Legislators are really wrestling over programs like Kid Care. What would you say to them about these stories and what the overall impact could be on our state if it's not confronted?
Kids Care is going to be 100% paid for by the U.S. Department of Health and Human Services. There's not going to be any cost to the state at all for until October 2017, and likely for a few years after that through 2019. It's really important for the health of Arizona to help these kids. The kids are not receiving services. They have school difficulties. They have problems in being able to go to specialists and get appropriate medicines. and it affects the whole families, because when the kids don't have health care, the whole family is disrupted and the parents can't go to work. In addition, when there's no, these kids' care is really important for kids with special health care needs as well, because those kids have really high expenses. Sometimes, like, 15% of their income goes to health care. So, and it's really important that these kids get taken care of. The children, Arizona needs to take care of its children because they are its future. So it's really important that Arizona pass this kids' care. 30 to 40,000 kids will get covered who didn't have coverage before, and that will affect exponentially the whole population, because it will help their families, it will help these kids succeed in life, and that's what we want for Arizona's future, is a healthy population of kids who have grown up, been able to go to school, been able to thrive. It's really important to take care of the children in Arizona. It's not a Democratic issue, it's not a Republican issue, it's just plain right to take care of your children.
The Children's Action Alliance is leading the push for what's known as Kids Care. Here's President and CEO Dana Wolf-Neymark.
We've had really a statewide effort of so many people coming together to speak up, asking our lawmakers to lift the freeze on kids' care. We've had enrollment frozen since 2010, and now we have the opportunity to bring kids' care back, to give affordable health care options to 30,000 children, and it will be paid for with the federal taxes Arizonans have already paid. So if we don't do that, our tax dollars actually go to children in other states when the need here is so great and so high. We want those resources and that help and that health care to stay right here in Arizona.
In your conversations with lawmakers, what have you learned? Because as you said, there are some who believed in it or who didn't, and now they do.
We have learned that constituent voices really make a difference, and we've been so inspired to have pediatricians and nurses and teachers and working parents and business leaders and faith leaders all around the state, philanthropic leaders as well, speaking up and joining together, saying we need to lift the freeze on kids' care. And we have seen that make an impact, because at the beginning of this legislative session in January, when the governor proposed his budget, never mentioned kids' care, wasn't interested. When he was asked, he really wasn't interested. We were very nervous that we didn't have much chance, but we knew how important it was, and so we invited Arizonans to join in the effort, and boy, did people respond. And also State Representative Regina Cobb, who's a Republican from Lake Havasu City, Kingman area. She's a dentist. She recognized immediately the critical importance of kids' care, and she has seen patients who lost their health care coverage, didn't have dental coverage, didn't have checkups, and how it affected their health. So she has been a passionate, determined, fearless champion of kids' care and sponsored the bill that passed the House, and she's continued to fight for kids' care all the way through.
Democrat Eric Meyer is House Minority Leader, and he's also a physician. Representative Meyer says lawmakers are wrestling over numbers in the budget.
Well, I think the hang-up essentially has been the Senate President, who doesn't want to see it happen. We passed a bill out of the House weeks ago with bipartisan support. I think around 50 of the representatives voted for it. I didn't support the cut that we made when we made it. We're the only state in the country that doesn't have the kids' care program. And as an emergency medicine physician, I see what happens when kids don't have health care, and this would restore health care to 30,000 kids in our state approximately. So we need to restore that if we want to attract pediatricians to our state and actually save taxpayer dollars by allowing kids to get primary care and not ending up in the ER. It would just be a great investment.
As a physician and as a politician, you're probably pretty hopeful this will pass.
Yeah, I actually am hopeful. This year, I hadn't been in past years, but I think there's a groundswell among rank and file members, and I think we'll see an amendment to restore the program.
The budget is really causing some turmoil here. What are the chances of this wrapping up this week?
There's a chance. I never know. It's whenever you get the 31 and 16 votes and the governor on board, all of a sudden it'll happen, and we could do it the timing is so that we could finish by tomorrow morning if we vote on it at, start voting at 12:01 Friday morning, and wrap it up. That isn't an open and transparent way to do things. I just left a meeting with a number of stakeholders who have many concerns about the budget. But that's the way the leadership and the governor have chosen to do this, and it's unfortunate for openness, transparency, and doing the right thing for the state.
What does that do to taxpayer Arizonans' trust of the government, of our state government?
Yeah, I think trust is at an all-time low of politicians, for good reason. When you don't involve the public in making decisions that impact them, they get mad. We saw that with the elections kind of debacle. And then we asked people to come down, and we didn't want to hear what they had to say, and they got angry, and understandably so.
How big a part is education in this year's budget?
It's non-existent. I mean, we're not funding our schools, either at the university level or the K-12 level. We're funding DCS, Department of Child Safety, so that's good. But when it comes to universities, we're giving $5 million for a freedom school, which is just a think tank that espouses getting rid of public education. It makes no sense. We should be directly focusing on things that reduce college tuition for our students across the state, and then invest in K-12 so that we can reduce class size, and we have a teacher retention problem that we absolutely need to address.
The question is how much more money to put into K-12 funding, and what will the numbers look like if Proposition 123 passes in May's special election. Representative Paul Boyer, a Republican, chairs the House Education Committee.
It's 4 components: small school weight, or additional assistance for schools that are smaller on purpose, district-sponsored charter schools, current year funding, that's a major issue, and then invisible space. Those 4 components are really what's holding up the budget process right now.
How does Prop 123 play a role, if any, in the budget?
I think it's more of a perception from those who are on the outside paying attention. From our perspective, I think they both need to pass. Just because the K-12 approach at the legislature is just a hold harmless approach. We don't want to hurt education. Some of the cuts that were implemented from last year's budget, we don't want to see phased into this year's budget. And then, of course, Prop 123, I think folks are looking from the outside saying, well, we're going to vote on Prop 123 based on what you do on this budget, because, of course, as you know, May 17th is the election, and so if we vote on a budget that doesn't protect K-12 education, there's a fear, and in some cases it might be legitimate, that the legislature as a whole doesn't prioritize education. And I want to make sure not only to change that narrative, but also to change the policy and make sure that we do protect K-12 education.
You're also a teacher.
Yeah.
So personally, there's a connection to this issue for you.
That's right.
Why is it so important that this pass and that education continue to get the funding that you say it needs?
Well, I think it does 2 things. Not only does it provide $3.5 billion over 10 years for K-12 education that goes into the base, so we let each district and charter decide this is where the money will go. We're not dictating it. It has to be earmarked for a particular purpose. And it also resolves the lawsuit. So as you know, there's been an ongoing lawsuit since 2010 where a judge said that the state of Arizona owes $3.8 billion. So that resolves that, it provides certainty, and it gets that money, that much needed money, into schools.
What sorts of things do you envision happening if this education funding goes through and then Prop 123? Does it change Arizona's face of education?
Well, personally, I'll be doing cartwheels. But no, I still think there's some work that we need to do. I think we need to communicate a long-term perspective that we really want to protect K-12 and university funding as well, but in particular K-12 education, and that means Prop 301 expires in 2021. So we need to have a long-term, serious conversation with the education community, with the leadership, with the governor, on are we going to extend it, are we going to expand it, what can we do to provide even more certainty to schools?
Is this really a question of how Arizona values education?
Well, you have to remember, we have 1.2 million students in the state of Arizona. We're a growth state. And so we do spend 43% of all state spending on K-12 education. It's the single largest budgetary item in state spending. So there is certainly a priority there, but I believe we can do more.
You're in a classroom. What sorts of things do teachers, do students need to continue to be successful?
Well, they need a few things. I mean, the salary, of course, is some would argue number one. They need to be supported. They need to have good administrators. They need to have good principals, assistant principals. They need to know that their voices matter when they raise an issue to their principals. And for my school, I need maps. I teach history. That'd be fantastic. But that's beside the point. I mean, we just need to know that, I think, to communicate a certainty that the legislature, that we have your back.
Democrats and Republicans are split when it comes to education. I spoke with Republican Representative TJ Shope. He's also a school board member in the Coolidge School District. You're one of the few Republicans who's actually pushing for more K-12
Right.
education funding. Why is that?
Well, and I think one of the things is there's actually probably a majority of the caucus in the Republican side in the House that's pushing for more K-12 dollars. I think that we've looked at the budget this year, at least leadership has, and I'm not going to knock them. They're doing what they think they need to do. However, I think that we want to make sure that at the very least K-12 is held harmless for this year's budget, looking at last year's.
The legislature always takes heat from the public when it comes to funding for education. What don't most members of the public know about what's happening here during this session?
Right. I think, well, first off, I think, yes, you're absolutely right. Legislature often does take heed for K-12 or for any kind of education. What many members of the public, when I go speak to folks, and I go out all the time, is it's about half of the budget. So we can argue about the pie size, perhaps, and that is probably right for discussion across many specters of political thought in this state. However, as far as the slice of the pie that education gets, it's half of the budget. So we do take it very seriously. I take it very seriously personally. I double as a school board president in Coolidge. So it is something that is always a topic of conversation for most of the members, because we know it is the largest single issue in the state budget on a year-by-year basis.
What if Prop 123 does not pass? How does that change things?
Wow, that's going to be a very awful thing to happen to education in this state if 123 doesn't pass. I've been at the forefront of making sure that it does. I believe in it wholeheartedly. As a governing board member, like I mentioned, at a school district, we are counting on that. My school district was one of the ones that last year was able to give a 5% raise to teachers. We hear it all the time, whether it's conservatives, whether it's folks on the liberal side of the equation. We want dollars to go into the classroom to make sure that our teachers are getting paid. And the best way to make sure dollars go into the classroom is to actually do that. Pay the staff that's there teaching our kids. We have tried to make that 123 in the fall is enticing for school districts as possible by making sure that there were no strings attached. They will get to determine. The general public then will have an opportunity to by influencing their local elected governing board members of where those dollars should go. I have a strange hunch that most of those dollars will go into the classroom in the form of whether it's teacher salaries or making sure that teachers in some districts that I represent maybe have had to take on added costs of health insurance, things like that. So maybe some of those fees will be waived, things like that. Yeah, if 123 doesn't pass, then we're back in court 2 to 3 years down the road until there's a resolution. I want the money to go to the kids right now.
Another budget item is for the Border Strike Force, more money for border enforcement. A few weeks ago, Senator John Kavanaugh from the Senate Appropriations Committee and I talked about the $30 million price tag.
It'll be funded. I'm not sure if it'll get the full $31.5 million. The recent restoration of the JTED money basically took the budget number for that from 10 to 30 million. So the other 20 million has to be found somewhere, and we're not increasing taxes. So I would suspect that it'll be whittled from different places. This is a pretty big ask, $31 million, and it's maybe something that could be phased in over 2 years instead of one. So I suspect a little bit might be chipped off of this.
Some of the criticism that we hear is that there are other border resources in the state. Why should the state be funding so much of this? So what are your thoughts on that?
Well, there actually aren't too many organized border resources. And I mean, we've seen a tsunami of drugs and illegal immigrants and smugglers coming over the border. So it's a terribly porous, under-patrolled border. You probably need $100 million to properly police it. So even with this full funding, we wouldn't be all the way to a secure border.
Some of the critics have said that this money could be better spent on things like education. What are your thoughts there?
Well, you can always say you can spend money somewhere else, but the bottom line is if you're not safe, then an education doesn't help you because you might be dead. So we have to take public safety as a priority in addition to education as a priority.
Your background is in law enforcement. This is particularly important to you and some legislators, though you said you don't have to have a background in law enforcement to understand the gravity of this situation.
No, absolutely not. I mean, I suppose somebody with a law enforcement background, having seen the victims of crime, is a bit more sensitive to the need to control crime. But everyone realizes that we're not talking just about illegal immigrants here. What we're talking about primarily from this strike force is drug smuggling, and those drugs kill our children and our adults when the drugs get over. There's human smuggling, prostitution. There's a lot of misery that comes across this border by organized criminal groups and drug cartels.
We've often heard that Arizona is considered ground zero when it comes to drug and human smuggling. In your conversations with law enforcement or based on this border strike briefings, what are you hearing that is most striking about what's happening along our border?
Well, the open door that it is. I mean, there's literally no stopping these people, and that they walk across the desert all the way up to the Maricopa County area. I mean, we literally have no control over what's going on, or very little control over what's going on, and parts of the entire southern half of the state, there are danger zones that people don't want to go into. So we need to get control back of our state. People need to be safe, and we need to keep the drugs out.
Senator Kavanaugh says the border strike force will mostly be funded, but it's still unclear what the final figure is. A legislative wrap-up now in the Buzz. Luigi Del Puerto from the Arizona Capital Times, thanks for your time today.
Thanks for having me.
What would you say is really the story of this legislative session?
It's all about school funding. It's all about K-12 education and the money that goes to schools or will go to school, or the money that may not go to school. That really is the gist of this legislative session.
So are lawmakers trying to solve this year's budget with respect to what might happen in May's special election?
It certainly is a big part of this budget. This budget presumes, for example, that the voters will approve Proposition 123. There's about $50 million in funding for the schools that presumes that the voters will say, yes, go ahead. This proposition that settles this lawsuit is a good thing, and you can go ahead and take money out of the state land trust.
So kids care, education continue to be some of the main sticking points out of this session. What does that say about what's happening in the state and what lawmakers need to consider as they make decisions?
Education has been, of course, a very big issue in the state for eternity, if you will, for a long time. But last 3-4 years or so, we have seen the state really take a look at education and say, what can we do to improve it? And the reason for that are a combination of things. One is that we've had reports about rankings of pupil funding that show that the state is lagging behind 48 states or 47 states or 49 states if you ask some. So that's one part of it. The other part of it is that the economy is improving. There's more money that the state is getting. We're anticipating getting about $630 million more in what we call cash balances for fiscal year 17. That's money that we can use as a one-time amount. Some of it could be used for ongoing spending. So there's that part of it. The biggest part, I think, is Governor Ducey this year in his State of the State address saying, look, we have to settle this K-12 inflation litigation that we have. The sense that he gave is that there's this narrative that we're not doing enough for the schools. Let's put a stop to that. And that was the sense, that was the impression that he gave. And as a result of that, we now have, as I mentioned, this settlement in Proposition 123.
Are lawmakers sort of waiting to see what the feeling is, the general sense in Arizona when it comes to Prop 123? Because it sounds like they have to wait and see, but they can't wait until the end of May.
Right, and the budget's typically passed, between March and first couple weeks of April. And we are now getting into the end of the month, and we still don't have a budget. And it's important to pass the budget early for many reasons. One is that agencies have to make their budgets, and if they have the numbers firmed up early on, that's good for them. But also, it's really good for the schools to know what they're going to get early, and that's why each year they try and pass a budget, as fast as they can. And of course, the budget's the only thing they really are constitutionally mandated to do. Every other law is they don't have to do any of those.
You've been covering the legislature for a while now. What is different about this set of lawmakers that you haven't seen in the past?
This year, there's not a whole lot of controversy that emanates from bills that deal with immigration, for example, or social conservative issues. I think this year has been more wonkish, more policy-oriented, if you will. And as I mentioned, I think that's a larger result of just the circumstances changing. We've had the chance to focus more on what we want to do for kids, for example, even for kids care, but specifically K-12 education, because we've had more money coming in than we've had in the past. And another reason for that is that I think the state has done or has tried to do what it could on the immigration front, for example, with 1070. And the court said, we can't really do a whole lot. And I think there's an understanding among lawmakers, even among those who support 1070 type of measures, that we've done what we could, and either we end up in litigation again and lose, or some of the members probably wouldn't go along, and those bills will probably just die on the Senate floor or on the House floor. And so there's not a whole lot of appetite for those kinds of measures. And of course, as I mentioned, the governor was really focused on improving the image of the state. I think to a certain extent he's done a good job of trying to prevent those types of bills from reaching his desk, which is also the job of the governor. If he doesn't want something, he does his best to kill it before reaching his desk.
As of our Friday afternoon recording, Arizona lawmakers still had not submitted a final budget. Arizona Public Media will continue to monitor the legislature's progress. Any updates will be posted on our website, azpm.org. And next week, an interview with Governor Doug Ducey. For all of us at Arizona Public Media, I'm Lorraine Rivera. Thanks for joining us.